This segment of Delmarva Life is brought to you by Community Behavioral Health.
Listen to this. According to the Anxiety and Depression Association of America, 40 million Americans over the age of 18 are affected by anxiety. That's roughly 18% of the nation's population. And 15 million of them suffer from social anxiety. It's a fear of interaction with other people that brings on self-consciousness. 1025 WBOC's Corey Phoebus has some tips to help curb that fear.
What makes you nervous in a social setting?
People watching me, everybody, a lot of them.
Confrontation.
Meeting people that I don't have anything in common with.
The first thing you can do is work to silence the nagging voice in your head that's beating you down. Try countering it with positive thoughts. I'm capable of anything. Things will go right for me. I deserve to be happy. By doing this, you're rewiring your brain and weakening anxiety's hold on you. Another suggestion is to play reporter. Ask open-ended questions to get the ball rolling when you have nothing to say in a social situation. Alternatively, ask follow-up questions that can take the conversation deeper. Studies have also proven that people respond better to positive reinforcement. So, reward yourself after each social interaction. Commend yourself for attending or being present rather than berating yourself. While anxiety disorders are the most common mental illness in the United States, only about 1/3 of people suffering actually receive treatment. So at the end of the day, if anxiety is disrupting your daily life, make an appointment with a mental health provider to seek treatment.
Now, a recent study by Johns Hopkins University suggests that mindful meditation can help ease physiological stresses like anxiety. Try downloading meditation apps on your smartphone, like the app Headspace, which walks you through the steps to practicing mindful meditation.
And you just heard there that anxiety disorders are the most common mental illness in the United States, but only about 1/3 of those who have them actually seek treatment.
Now, it doesn't have to be that way, especially if you know what's involved in treating social anxiety. So to help us dig deeper into social anxiety and the treatment of it, this is Dr. Suni Jani, the psychiatrist at Community Behavioral Health. Thank you so much for joining us again.
Thank you.
It's great to have you back. Okay, so you just heard the statistics.
Yes.
Only like 1/3 of the people actually seek treatment. Does that surprise you?
Not actually. I actually feel like I don't see as many people as I could see on an outpatient basis. So I've worked in emergency rooms and I've worked in inpatient units, and a lot of people seem to self-medicate. So you'll see a lot of people with anxiety who also have substance-related issues. So a lot of people will say, I feel as though I'm self-medicating. And so when anxiety goes untreated, people will go to more unhealthy means to try and get rid of that overwhelming nervousness, fear, and apprehension with something that works quicker. So it may be 1/3 are going untreated through some of the mindfulness techniques that you mentioned earlier, but they are going treated through less safe means.
That's a shame. So, last time you were on, you were talking about the stigma with mental health, and social anxiety is a mental health issue. Do you think that might play into it too, why they don't seek treatment?
I think that's a very important point. That is a massive aspect of it. So social anxiety, according to the Diagnostic and Statistical Manual of Mental Disorders, is a persistent fear of performance and social situations, and the fear of being scrutinized and humiliated. So coming to see a psychiatrist, coming to see a psychologist or a therapist is a social situation in and of itself. And a complete stranger and telling them something that's this vulnerable and wondering what they'll think of you in such a new and vulnerable setting is something that not a lot of people want to do, especially when it's an anxiety disorder that's causing you to lose functioning in so many ways. So I'm not surprised.
Is it normal to have a social anxiety?
It's normal to have social anxiety. In fact, in many ways, it's something that kind of helps us get along with each other. So for instance, grooming, in a way, can be argued as a social anxiety. It's what makes us comb our hair and makes us sort of approach each other, and in a thoughtful way, it keeps us having good hygiene. But a disorder is when we lose functioning. A disorder is when we're living our lives differently to avoid something that we could be doing and could be sort of prospering and bringing something to our community. So social anxiety is fine. Social anxiety disorder is when we need to seek help.
So what are the symptoms? I mean, I imagine avoiding those situations would be one symptom. Are there others?
There's persistent distress, there's restlessness, there's always wondering about how you're appearing to others, there's always wondering if others can see that you're anxious, and always wondering if the whole world is having its eye on you and scrutinizing you, and really being this person that's wondering about others' perceptions of you in a negative way, rather than thinking something positive about yourself, and how others might be even remotely thinking something positive about you is not even on the horizon. You're constantly negatively self-judging.
Is medication a part of treatment?
It is in severe instances. So medication, I would say, is maybe a minute part of treatment for people that are in a minute part of cases that are severe. So whenever in any mental health discussion people bring up medication, it's only because we're talking about someone that's so functionally impaired they can't even bring themselves to go and seek non-medication related options like mindfulness. Cognitive behavioral therapy is actually one of the gold standards of treatment for many mental health conditions, especially social anxiety disorder.
All right, so what would you say to somebody who may be watching today who's like, wow, that's me? What would you say to them?
So I can appreciate that you have social anxiety, and you're very aware that you have social anxiety, and you're afraid to ask for help because you're worried about someone judging you on the or wondering about what you're like and thinking about you. And so I can appreciate that it's hard to pick up a phone or even make an appointment. Download an app like the app that you brought up. Just try little baby steps to try and be able to organize what you're thinking and how you're feeling. The little baby steps are what matter. Go as far as you can tolerate going, and make the most of what you can do today. And if you can't, go straight ahead into therapy, that's okay. Do what you can, and eventually, when you're comfortable, try and talk to a therapist. And if you can go further than that, that's wonderful. And I applaud you for that much. But go as much as you can, and that's incredible. That's what I'd say.
You don't have to live this way.
No, you don't have to live this way.
That's awesome. Dr. Johnny,
Yeah.
thank you
Thank
so
you
much.
so much.
Wonderful having you.
Yeah.
And if
thanks.
you would like to read more about community behavioral services, including the mental health services they provide, go to our website, delmarvalife.com.